The administration of Governor Umoeno in Akwa Ibom State recently secured 100 hectares of land as part of a program to enhance the state's tourism appeal through an expanded investment in medical facilities and services. A key plank of this plan is the establishment of a medical city, which is expected to serve as a hub and lever to extend fundamental healthcare to as many citizens of the state as possible. For us to explore this subject further, we are now being joined by Dr. Ekem John, who's the Akwa Ibom State Commissioner for Health. Good morning, Dr. John. Good to have you join us on the morning show today.
Good morning, Steve. Thank you for inviting me.
It's our pleasure.
And good morning, Adesua.
Good morning, Doctor.
Good morning. All right, let's talk about the developments in your state. There is an approval that practically everybody is talking about from the governor regarding the counterpart funding of many projects that are there on the ground. And then, of course, there is also the medical tourism component of it. 100 hectares, as we've been told, has been approved. The design has been done. It looks like things appear to be looking, upward for the health sector in Akwa Ibom State. Talk to us about it and how significant all these developments are.
All right, thank you, Steve. I'll say that this is actually one of the most exciting moments in my career as a medical doctor, because I'm beginning to see many of the things that we wished and prayed for happen, working with His Excellency, the Governor of Akwa Ibom, Pastor Omo. Let me say that you're very spot on, but with the design, the facility is even now expanded beyond 100 hectares. That facility is going to house what we call the Ibom Medical City, which is a component of several medical facilities put in one. So the idea is, His Excellency, the Governor of Akwa Ibom, is big on medical tourism. And since he arrived as governor in 2023, has consciously made tremendous investments in healthcare. One of it is in primary healthcare, and is also investing in secondary healthcare and tertiary healthcare. But there's also the fact that Nigeria loses a lot of money to medical tourism. Beyond the money that is lost, the time that is wasted in having to seek for care outside the country jeopardizes the chances of citizens surviving from the occurrence of such disease when it does happen. And we all know that trouble comes to every man, whether you're rich or whether you're poor. The best thing is for us to be prepared. And one of the things the governor decided to do is to create an ecosystem that would allow for a reversal in medical tourism. So starting from where you have the Itam flyover, the concentric flyovers, which was built when the Senate president was governor, taking it to where we have the 4 Points by Sheraton, all of that area has been earmarked as the Ibom Medical City. So right there, we have what we call the Ibom Specialist Hospital, which is already there, and the government is working to revamp its operations. Then we also have what we call the Ibom International Hospital, which is now under construction. If you send your reporters to go to the site, you will see that the contractor is on site working night and day. Like you have said in your introduction, it's an expansive area that covers over 100 hectares of land, and work is ongoing there. It's right in that facility, we have a comprehensive cancer center. We have a transplant facility, we have specialty clinics, we have super sterile theaters, we have robotic theaters, and then we have simulation centers. As a component of that medical city, there's going to be a pharmaceutical manufacturing hub, there's going to be a pharma distribution hub, and then there's going to be medical institutions for research and learning. We're hopeful that we'll be able to put up examination centers where professionals could come for update courses and have their exams. So it's an expansive vision, and the idea really is to be able to allow for the idea is to be able to allow for the Ibom Medical City to serve as a one-stop shop for everything healthcare in Nigeria. That's the direction we are headed.
Thank you, Dr. John. Now, this sounds very impressive and also very good to try and get medical tourism into Akwa Ibom State. But when it comes to primary healthcare delivery for people already in the state, and particularly for people in rural areas, what work is being done to improve this?
Thank you for that question. I think Governor Moino is probably one of the few governors of Akwa Ibom that has focused on delivering primary healthcare services. I'll tell you a story. In 2024, the National Primary Healthcare Development Agency, and you can fact check this because they are the ones generating the data and we're just sharing that data. In 2024, they did a baseline assessment of primary healthcare facilities in Akwa Ibom, which would pass for level 2 facilities. Level 2, L2 facilities are now the minimum level that is seen as deemed to be acceptable within the health space, where you must have a minimum of at least 4 skilled bed attendants, and then the facility is revitalized structurally and equipped. So in 2024, out of the 468 health facilities that are primary healthcare facilities run by the government, both local and state, only 29 was classified as L2 facilities. By December 2025, in 12 months, Akwa Ibom moved to one of the highest in the country. Currently, 109 facilities are now classified as L2 facilities. That is a 375% progress under 12 months. And as I speak to you, we have more than 50 primary health centers, which we are reworking, rehabilitating, renovating, and retrofitting to allow us to achieve the functionality of that minimum L2. In some of our facilities, you would classify them above the L2 standards because they come complete with accommodation for the doctors, accommodation for the nurses and other healthcare workers. We have fully functional lab, we have nutrition centers, we have demonstration kitchens to tackle the problem of nutrition and teach the rural women how to prepare balanced diets and begin to reverse the challenge of malnutrition and stunting, which has been a problem. We have adolescent clinics for counseling on STIs and other adolescent health issues. And then we have procedural rooms for family planning and all of that. I can see you've projected some of the designs that we have. And these designs are uniform across the state. So we're building these, and those are staff quarters. People are living there. And the interesting thing is also that all of these facilities we're putting up, they run on solar. So it's not a question of whether there is power supply. You know that healthcare really cannot function properly without power supply. So His Excellency the Governor insists that for every health facility we're putting up, those facilities run on solar system. So they are completely off-grid. The national grid now serves as a backup. But not only that, we have a second backup, which is the generators. So we are allowing these facilities to be self-sufficient. And for primary healthcare alone, we've gone there. Now, in this year, 2025, in order to improve on primary healthcare programming, His Excellency approved funds for counterpart funds. You know, primary healthcare is one area where development partners and the Federal Ministry of Health, the National Primary Healthcare Development Agency support states. But states are also required to show ownership by paying a counterpart fund. As at today in January, His Excellency the Governor has approved all the counterpart funds that Akwa Ibom would need to pay in 2025. Right. And so that tells the commitment with which the Governor approaches healthcare for citizens.
All right, Dr. John, very quickly before we let you go, I like the fact that you made reference to a report that shows how well that you are doing in some aspects of primary health care. But I'm wondering if you are also aware of the Nigerian Demographic and Health Survey capturing 2023 and 2024, which one of the major online newspapers in Nigeria made reference to when they focus on the health situation in Akwa Ibom State late last year. I'm sure that you know that what that survey revealed was that Akwa Ibom State has one of the lowest percentages, and that's put at 38.6% of live births delivered in a health facility in the country. It stated that it ranks lowest among the 17 southern states of Nigeria. It also ranks lower than 5 of the 6 north-central states and 3 out of the 6 northeast states of Nigeria. Not only that, the report also showed that Akwa Ibom has one of the lowest percentages of births delivered by a skilled provider, 51.5% in Nigeria, the lowest across the southern and north-central states except Niger State. So as you are looking at the areas where you're improving, are you also focusing on the areas where there are challenges? Obviously from this survey that captured 2023 and 2024. What are you doing about it, and what should Akwa Ibomites expect throughout this year as far as health is concerned in Akwa Ibom State?
Yeah, thank you, Steve. I had read that report. I'd read that report, and I can tell you that we're working very hard at it. For example, you talked about the number of skilled birth attendants. If you look at that demographic surveys, the data usually is collected a year or two before. But I'm sure that when they do the 2025 State of the Health of the Nation, there would be some improvement. For example, the one for 2026 would even be better, because in October last year, we started the process of recruitment, and we are adding a total of 3,300 healthcare workers into the system between this January and February. So by the time the survey will be done for 2026, Akwa Ibom will probably have one of the highest. These are peer review mechanisms put together at the federal level to allow states to have healthy competition. And the beautiful thing about Akwa Ibom is that when this comes to us, we respond positively. I'll give you an example. From that National Demographic Health Survey, you could also see that we didn't do too well in terms of how many L2 facilities existed in the state in 2024. We responded to that in 2025, and we're still doing that because, like I said, what we've been able to do is only about 30% of all of our facilities. So even for this year, we're going to be doing so much more until we cover all of the 468 facilities. We're also responding in terms of healthcare. Now, there are 2 components to the problem of delivery in health facilities. One is that the skilled birth attendants are not there. And you know that there's a general global problem of human resources for health. But we're responding to that by employing new people. And beyond that, we're providing incentives that will make it irresistible for any healthcare professional who is out of job not to want to join Akwa Ibom. As part of that response measure, the state governor declared a state of emergency in the health sector in September 2025, and it's going to run till September 2026. And one of the first steps the governor took was to make the remuneration of healthcare professionals competitive. Today, if you work in the health sector in Akwa Ibom, you earn at least 40% more than your counterparts in the federal sector, grade level for grade level. And these are things that you could check. Just take the salary scale for somebody, a doctor who is on grade level 12 or 13 in the federal scale, and compared to what Akwa Ibom is doing. So we're not giving out arbitrary figures. It was an intentional thing that His Excellency wanted to do, to offer better pay to attract people to come. So that means we're aware and we're working towards it. Then in terms of the skilled birth attendants, there's also the cultural issues, which we are now mounting intense sensitization campaign, because there are people who belong to religious sects that will tell you, oh, we cannot go to the hospital. If you go to the hospital to deliver, you're going to die. Those cultural myths exist, and we're working very hard to break them. And you know, Steve, that the challenge of culture is not something that you break very easily.
Yeah.
But what I can tell you today is that we have more skilled birth attendants attending to patients than we had in 2024. And you do not need to take my word for it. You can fact check with the data available to the National Primary Healthcare Development Agency. But just before I go, to tell you
very
that there
quickly,
are
Dr.
lots
John,
of improvements.
we run out of time.
In 2025, yes, very quickly. In 2025, we had only 68,000 new patient visits. And in 2024, and in 2025, we had 483,000 new patient visits. That's a 700% increase.
Okay.
It means society is beginning to have confidence in what the government is doing. Thank you.
Fantastic. All right. I want to thank you, Dr. Ekem Emmanuel John, Honorable Commissioner for Health in Akwa Ibom State, for joining us on the morning show today. Well done. Well done. I mean, you're doing quite well.